Hi, I'm Dr. Amiti Agarwal, Medical Director of Sunshine Fertility and IVF Center, Mumbai. So often I am asked this question that if I've had multiple miscarriages, doctor, can I get pregnant again? So the answer to that question is yes. In fact, we've had patients who've had more than 12 abortions, more than 8 abortions, 9 abortions, and they've gone home with a baby. So most importantly, when you have miscarriages, it is very important for your doctor or your IVF specialist to evaluate the reason of the infertility. It's very important that you give a detailed history about your previous miscarriage to the doctor. Most importantly, what is important to understand is whether this miscarriage was a first trimester miscarriage or a second trimester miscarriage or a third trimester miscarriage. Trimester means 3 months of your pregnancy. So first 3 months is called first trimester, the middle 3 months is called second trimester, and the last 3 months is called third trimester. So there are various causes of the miscarriages in a patient. So most importantly, I have seen patients commonly coming with first trimester miscarriages, and the most common reason for that is some kind of a genetic abnormality in the embryo, or it could be because of a syndrome called as Apla syndrome, or it could be because of various immunological factors which are now coming into picture. There are a lot of diagnostic tests which help us identify your cause of miscarriage, and once the cause is identified, then we can give various therapies, we can give various treatments, we can do all sorts of different protocols to protect your pregnancy, and we can help you take home baby with all the treatments which are available. In this segment, most importantly, which is now coming up in a big way, is reproductive immunology, in which we try to understand the immunological causes of miscarriages, and we can treat that by a very good upcoming therapy known as lymphocyte immunotherapy or human lymphocyte therapy. So this is known as LIT or HLT, which really helps in prevention of miscarriages in patients who've had previous miscarriages. Also, this therapy is helpful for couples who've had previous IVF failures where the cause of IVF failure is not known. The embryo quality is good, the endometrial lining is good, the transfer was good, everything has been good, but still the patient comes negative. Many times when we do the investigations for such couples, we can understand that there is an immunological cause, and once we do the therapy, we can have a pregnancy. Not just LIT therapy, there are a lot of other treatments also which are available which can help in overcoming these immunological factors like intralipids, immunoglobulin treatment, and various immunomodulator drugs in your treatment protocol. The other important segment is the genetic factors. It is very important to do the karyotyping of the couple, not just for the wife but even for the husband. Even he should be tested thoroughly to see if he is having any genetic problems. Other thing is, now there is the very advanced technology of PGT and PGD, which is the pre-implantation genetic diagnosis, in which we test the embryos and we choose out of that which, if the embryo is abnormal or if there is any aneuploidy or any translocation or any abnormality in the embryo, those embryos are discarded, and only the ones which are genetically normal embryos, those embryos are implanted into the uterus. This is the two important factors. Plus, in Apla syndrome, we can put the patient on blood thinners, we can put the patient on ecosprin, and we can help the patient overcome this problem of having multiple recurrent miscarriages. So there are various therapies, various treatments. The whole point is that you should be able to reach a doctor who is going to be efficient enough to understand what exactly is the cause of the miscarriage and to help you overcome this problem with his or her expertise. So you can get pregnant with multiple miscarriages, just find the right doctor.